Welcome to HUR at Home. I am your host, Bramante Bryan. Thank you so much for joining us tonight. A very important conversation that we're having. It is September 1st, and September is Sickle Cell Awareness Month. And did you know that there are 100,000 people in the United States living with sickle cell disease? The Howard University Center for Sickle Cell Disease is hosting virtual activities all month long to inform and engage the community about sickle cell. Our guest tonight joining us to help us further this conversation and inform us about the things that we may not know about sickle cell, Dr. Wayne Frederick. He's the president of Howard University. He is also living with sickle cell. And Barbara Harrison, she's the assistant director of community outreach and education for the Howard University Center for Sickle Cell Disease. Thank you both so much for joining us here tonight.
Thanks for having us.
Thank you. Happy to be here.
Dr. Frederick, I would be remiss if I at least didn't ask you about Howard alum and now the late Chadwick Boseman. I know that you had issued a statement about his passing, but if you could share your thoughts, briefly about Chadwick Boseman and his stunning, for many of us, passing.
Yeah, certainly sad. The impact that he had was incredible. He was a talent, very gifted actor, and I should say more a gifted artist because he was a very good writer as well. Was into directing. I mean, that's the entire thing about the craft. He was there for it. But I hope what we would all take away from him is that he was an exceptional human being. Kind, humble, noble presence at all times. And so that's what I will continue to remember. And while I'm sad, I'm overjoyed that one person could live such a full life and so many people. And for that, I'm grateful.
Well, thank you so much for sharing that, Dr. Frederick. Barbara Harrison, tell us what we should know about sickle cell.
Mm-hmm. Well, sickle cell disease is a genetic condition, and it impacts primarily those of African descent. Now, in the United States, and that equates to African Americans, but it's important to also recognize that worldwide, it affects people in many different countries and ethnicities. But sickle cell disease is an issue with the blood. It is a condition that affects the red blood cells and how they're able to carry oxygen. And so this results in quite a array of problems in individuals that have sickle cell disease. But one that many people know about is the hallmark finding of the condition is pain. And so there can usually be a level of pain that all individuals that have sickle cell experience, but then at times it does spike, and we generally call this a pain episode or pain crisis.
Dr. Frederick, as I mentioned at the top, you have sickle cell, you are living with sickle cell. Tell us how it's impacted your life.
It's been a very significant impact. I was diagnosed at birth in 1971. I was born in Trinidad and Tobago, and they began mandatory testing for all births in 1970. So my parents found it at birth. Growing up, I would say I was hospitalized once or twice a year minimum for the pain crises that Ms. Harrison just described. I was fortunate not to have a lot of the other complications, but it has had a dramatic impact. While I was a surgical intern, I had my spleen removed to prevent injury because my spleen was very large. So I've had a major operation as a result of it. I had my tonsils removed, unrelated to my sickle cell, but subsequently got really dehydrated and had to be hospitalized again as a result. So it has had a profound impact. It was, I would say, in many ways, my motivation for wanting to become a physician.
I was going to ask you that if that had an impact.
Yeah, it had a major impact. I think growing up in a hospital, so to say, and my mom being a nurse and seeing the sacrifices that she was making for me had a profound impact. So it had. My mom doesn't like to hear me say this, but I do sometimes think that it was a blessing in disguise because it was motivating me as well as it got me into a community of patients and caregivers and others who are passionate about this disease. And I have certainly been blessed to have met them and also been the beneficiary of their kindness as well.
Barbara, talk about how sickle cell affects specifically the African American community.
Mm-hmm. So the individuals that have what we call sickle cell traits, these are individuals who don't have the disease but carry the genetic information that could cause the disease in the next generation. Individuals with sickle cell trait actually have protection against malaria. And so in the areas of our world where malaria is rampant, individuals that have sickle cell trait tended to survive as opposed to those who did not. And so that's how for generations and generations, sickle cell trait really was a protective trait for those individuals. Now, through the slave trade, that's what primarily brought that gene to the Americas. And so therefore, and again, in America, we primarily see African Americans being affected. But again, other parts of the world, the Mediterranean and so forth, where malaria is persistent, you'll find sickle cell trait or variations of it.
Dr. Frederick, how has COVID-19 affected, or what impact does COVID-19 have on those who have sickle cell?
Yeah, we are more vulnerable. It's a risk factor. One of the disease processes you can get with sickle cell is called sickle cell test syndrome, in which because of the sickle cell impact on the lung, you can have difficulty oxygenating and your lungs can become less pliable, as it were. And so when you think of the COVID-19 infection and the respiratory disease that it causes, along with the fact that it can decrease the exchange of oxygen that's taking place, patients like myself with sickle cell are at risk. And so what we've seen so far is that those who have sickle cell who've gotten the disease can have a very bad outcome as a result. And so protecting themselves, social distancing, all of those things are necessary. And that's I still operate, as you know, so I'm still going to the hospital on a regular basis, but trying to make sure that I'm taking all the necessary precautions, wearing PPE, keeping 6 feet away, and washing my hands, very frequently.
And so, Dr. Frederick, where are we in the sickle cell fight in terms of cure, in terms of treatment for pain, and all of the things that unfortunately come along with carrying this?
Actually, I would say, there's an African proverb that says, after the night, the dawn will break, regardless of how long you think that night is. And I think the dawn is breaking on sickle cell. I have just joined a company's board myself, Forma Therapeutics, primarily because one of the primary focuses in terms of the disease process is on sickle cell. They would invent a drug that would improve the oxygen carrying capacity of the hemoglobin. You have gene therapy that is taking place through something called CRISPR. You have stem cell transplantation that's taking place. So you have avenues. I've actually met people now who've received gene therapy who are basically in remission of their sickle cell. And it's been amazing to meet those individuals in my lifetime. The evolution of that has been incredible. I think our understanding of pain control has gotten better. There are more advocates like Harrison and others who have sensitized physicians like myself about patients like myself that how we treat pain and how we approach patients with sickle cell pain has to be different. So I really feel that the dawn on sickle cell management is here, and we certainly have to step into that moment well.
Barbara, are there misconceptions about sickle cell? Do people sort of have thoughts about it that are either, old wise tales, or have folks been more educated? Have things changed, or are they the same? Or what's the sense in terms of the education, the knowledge of
Right. Well, I would say there's quite a few misconceptions. I think one of the biggest hurdles that we face are people who think that sickle cell disease doesn't exist anymore, that there was already a cure for it. There was a lot of talk about sickle cell disease in the 70s, and then that quieted down. And I think people just had this impression that it wasn't important anymore, when indeed that was not the case. We often talk about myths such as, sickle cell disease is contagious. I work in genetics, and, I can't tell you the number of people who feel when they have sickle cell disease, they just got it from one parent, and it didn't come, it's something that is not A, anyone's fault, and B, is really a result of genetic information from both parents. So, and then, unfortunately, individuals that have sickle cell disease often are not treated well when they go in for care. When they go in for a pain crisis, they don't necessarily look any different. They don't have any physical evidence of the pain that they're in. And so oftentimes they therefore fall victim to biases that physicians or other healthcare professionals may have, with feeling like they're just there to seek drugs. They're just there, to get opioids, when indeed they are in significant pain. So, people who have sickle cell disease do face those misconceptions when they're out there in their community. And so it's important for us to educate and to let the community know that these individuals need assistance, but also that sickle cell disease does not have to stop you. And some of our best advocates that have sickle cell disease will be quick to say that they may have sickle cell disease, but it does not control them, and that they are able to overcome that. I think Dr. Frederick said it well, whereas it can be a motivator. You take that challenge and do what you can to overcome it or use it to empower you. And so we definitely try to send that message as well.
Dr. Frederick and Barbara, there are a series of events coming up since this is Sickle Cell Awareness Month. Talk a little bit about some of those events that you might be involved in, where others can be involved in and become more aware of sickle cell, help raise funds, whatever can be done in a positive nature. Dr. Frederick?
Yeah, September is Sickle Cell Month, and I think there's lots of activities. The one that I always look forward to is participating with the Howard University Sickle Cell Center. They usually have a walk. Obviously, this year, I'm pretty sure that will be different. Charleston will tell us what that would look like. I think it's also an opportunity for our entire African American community to become educated. And I'd like to encourage everyone, regardless of whether or not you have a family member with sickle cell, just because of the devastating impact it has on our community, it would behoove every one of us to really learn about it, and also to pass on that knowledge to your own circle. And so, and there are lots of opportunities through the Howard University Sickle Cell Center to do exactly that as well.
And that's what I was going to ask you, as an educator and a doctor, how can they do that? But you got to it before I asked you. Ms. Harrison, some of the events that you might be involved in, and those that you would suggest others can be involved in.
Sure, I will definitely take this time to do my shameless plug for the premier event for the Howard University Center for Sickle Cell Disease, which this year is Cure Sickle Cell Now, Move On event. And so this is a virtual month-long event. You can look up Cure Sickle Cell Now on Eventbrite to get all of the information and to be able to register to get a very nice shirt that says Cure Sickle Cell Now. And then we encourage you to participate in a number of fitness activities that we have going on during the month, as well as being able to go out on your own and walk and proudly wear your shirt. We have also hours of DJs that are going to play music. So if you want to walk or run and do those, you can participate in those as well. And then lastly, we do have a pair of sneakers from Kevin Durant, who has given them to us to be able to give on our last day, September 30th. So we really encourage everyone to just go and get more information from our website.
All right. Well, you got to be a big man or woman to wear those sneakers. But, even if you sit them on your dresser, I guess
they're quite valuable.
Well, we thank you all so much for joining us tonight. Important conversation. And it's an awareness, as you both have said, that we all need to pay more attention to, and an important topic. Thank you so much, Barbara Harrison, Assistant Director of Community Outreach and Education for the Howard University Center for Sickle Cell Disease, and Dr. Wayne Frederick, President of Howard University. Thank you all so much for joining us.
All right.
Thanks for having me.
All right, that's it for WHUR at Home. You can see many more of our segments. Just go to WHUR.com. You can see me. You can see Angela Stribling. You can see Jackie Gales Webb. You can see Easy Street. You can see Harold Fisher. We are all there. So be sure, WHUR.com to see more segments of HUR at Home. Thank you so much for joining us. Have a great night.